Now today I'll be talking about CT angiography of the brain. Now CT angiography brain is very commonly done, and we must at least understand the basic cerebral vasculature or basic arteries which are supplying to the brain. Now when we zoom in, there is a very nice picture which we can see, and the most important thing is the circle of Willis. So the brain is supplied by a circle of Willis which has a symmetrical blood supply on the left side and on the right side. So we have two arteries, one artery on each of the side to complete a circle. Now circle is completed by total of three main arteries, that is anterior cerebral artery, middle cerebral artery and the posterior cerebral artery. So when we zoom out, we know that internal carotid artery is the main branch, which is a internal carotid artery which is a branch of common carotid artery, and this internal carotid artery comes into the brain and gives anterior cerebral artery, middle cerebral artery and posterior communicating artery. These are the three main branches which it gives. And to complete, so this internal carotid artery gives anterior cerebral artery, middle cerebral artery and posterior communicating artery, whereas the posterior two vertebral arteries, the vertebral arteries are the posterior arteries. Basically on the posterior aspect we have two vertebral arteries which come and form a basilar artery which continues as a pontine artery, and these basically basilar artery gives two branches, which is posterior cerebral artery. So this posterior cerebral artery then joins the middle cerebral artery through a posterior communicating artery, which is actually a branch of again internal carotid artery. So when we see this on the real-time image, we can see it very well. So we have so many images to see it very crystal clearly. So this is basically the right-sided vertebral artery, and this is basically right-sided vertebral artery. So this is left vertebral artery and this is right vertebral artery. These two join and form a basilar artery which is present in the midline. So this is the basilar artery because this is present at the base of the skull, and then it divides into two branches, which is posterior cerebral artery. So this is the posterior circulation. So we can simply trace this everywhere, like this is the right vertebral artery, left vertebral artery, basilar artery, then this is the left posterior cerebral artery, this is the right posterior cerebral artery. Now the most large artery in MR brain angiography is internal carotid artery, and this is all internal carotid artery. So this is a large all internal carotid artery, and we can very well see that in this angiography this vessel is so well opacified, means this internal carotid artery is completely free. The vertebral arteries are so beautifully visible. Here also this vertebral arteries are so beautifully visible, the basilar artery is so beautifully visible. It means that there is no any blockage in this artery, otherwise you would not be able to see them so beautifully. One more thing, if the patient has a very bad diabetic disease and if it has very much irregularity or calcifications, then you don't see this artery so well. You will see them as having irregular margins. So there are no irregular margins. It means that these vessels are pretty clean and clear, and they don't have blockage or severe calcification or severe atherosclerosis in them. So this is the posterior circulation. The anterior circulation is all by this main internal carotid artery. So this is all internal carotid artery, which has the main branch which supplies maximum portion of the brain, and that is middle cerebral artery. And this is all middle cerebral artery. This all is middle cerebral artery, which gives them extensive branches, and it supplies almost to the whole brain. So if you see, the middle cerebral artery almost cover this much portion. The posterior cerebral artery almost covers this much portion, and the anterior cerebral artery almost cover the frontal portion. So this is the area which is usually covered by this arteries. So whenever there is blockage of some particular artery like MCA or PCA, then this is the area which is called watershed area, because this is the most terminal part for this MCA to supply. Also, this is the most terminal part for the PCA to supply. So if the patient has PCA blockage or MCA blockage, the patients tend to have very commonly infarct in this area, which we call it as watershed infarcts, which are very common. So what we have seen is the two vertebral arteries, which are very well visualizable, then basilar artery, then the posterior cerebral artery, then internal carotid artery, then this bilateral middle cerebral artery. Now the next artery which we can see is very clearly we can make out is this anterior cerebral arteries. So these anterior cerebral arteries meet via this anterior communicating artery, and then they supply this anterior portion of the brain, which is mostly the frontal lobe. So this is all supplied by anterior cerebral artery, and this is how it completes the circle of Willis. So this is a very beautiful cerebral angiogram, which shows very well patent anterior cerebral artery, middle cerebral artery, and posterior cerebral artery with vertebral arteries. This patient actually was a young female patient who presented with headache and altered mental status. She had subarachnoid bleed, and that is the reason why the CT angiogram was done. And surprisingly, what we can see is there are multiple small round lesions. Now the vessel should be completely like this, which we can see trace. There is no any round lesion into it. So round lesion is only possible if the patient has this cerebral aneurysms. So if this artery is there, this is, just see, this is the artery, this is one of the branch of the artery, but there is no any aneurysm. But in some patient there is abnormal dilatation of the cerebral artery, and because of the high blood pressure or because of the pressure, these aneurysms, these are the aneurysms which are basically, they have a thin wall. Over a period of time, this abnormal dilatation of the cerebral arteries, because of the pressure, they can rupture and they will bleed into the subarachnoid space, because the circle of Willis is present in subarachnoid space. So this will bleed and the patient will have subarachnoid hemorrhage. That is the reason why cerebral angiography is done. That is the reason why digital subtraction angiography is done, and the call is taken whether to put a coil or whether to clip that aneurysm. So in this particular angiogram, a very well noticeable aneurysms can be seen. See, we can very well seen these aneurysms which are there. We can very well notice the aneurysm, which are abnormal dilatation of cerebral blood vessels, which have thin walls and which tend to rupture, and that may occur at any point of the time, and the patient may have subarachnoid hemorrhage depending on the bleed. And subarachnoid hemorrhage usually presents with sudden onset of severe headache. So subarachnoid hemorrhage is considered one of the most severe troublesome headache of the life, and the patient may have altered sensorium, and depending on the bleed the patient may have very bad prognosis, and most of the time DSC is done, and the call whether to clip or coiling is taken by neurosurgeon or interventional radiologist. So this was all about this cerebral angiogram for today, and thank you.